Blood vomiting is a very scary thing, both for the patient and the one who surrounds us. What are conditions can cause blood vomiting? So, most common condition these days which cause blood vomiting or hematemesis, which is the medical term used for blood vomiting, is liver disease. Now, what happens in liver disease? The blood vessels going to the damaged or cirrhotic liver have an increased resistance. It cannot go into the liver very easily. Now, instead, they find alternative pathways, one of which is close to our foot pipe and stomach junction. So, there what happens? The blood vessels slightly dilate and form something called as varices. Now in this varices, the pressure of the blood flow is very high when compared to that of non-variceal blood vessel. At certain amount of time when liver disease becomes very bad, the pressure becomes so high that these varices or dilated veins can rupture and can cause blood vomiting, which is the very common cause of blood vomiting these days. Common conditions which can cause blood vomiting include ulcers, which was very rare after the advent of certain drugs which can reduce ulcers. But yes, we are in an era where we take lots of painkillers which can again cause ulcers, and at an extreme stage these ulcers can cause blood vomiting. Rare conditions of blood vomiting, like so when we retch a lot, what happens? The mucosa of the foot pipe and the stomach abrade with each other and their small gap in mucosa happens and bleeding can happen, but this is self-limiting. It is not going to be a prolonged one. Rarely cancers of our foot pipe, cancers of stomach, cancers of gallbladder, cancers of duodenum, cancers of pancreas can present as blood vomiting. Very rarely, certain abnormalities in the blood vessels of the stomach, such as angiodysplasias and something called as duofoil lesions, altered blood vessels. Okay, these things can cause blood vomiting. So whenever blood vomiting happens, it's prudent to immediately take a consultation from a gastroenterologist. If the patient is having decreased BP because of excessive loss of blood, then he may require an ICU stay. Ultimately, an endoscopy will give us why the blood vomiting has happened. And most of the times, believe me, blood vomiting can be controlled with certain measures through endoscopy only. So whenever someone has blood vomiting, don't panic. Get them to doctor or get them to emergency room immediately and consult a gastroenterologist and do whatever is required.